To give an introduction to my topic at hand, I'm speaking on the importance of health literacy, which is crucial for effective public health, social factors that impact health literacy. They're strongly linked to income, education levels, challenges for low-income individuals would be poverty, limited education, and lack of resources can hinder health management. Consequences of low health literacy are worse health outcomes, increased prevalence of chronic diseases, higher healthcare costs. Some contributing issues are also, like I said earlier, poverty, limited education, and lack of resources. There is a need for action so that improving health literacy can reduce health disparities and support vulnerable communities. My problem statement is limited health literacy among patients in lower income communities, exacerbated by factors like poverty, inadequate education, and lack of resources, hinders informed health decisions and underscores the need for targeted interventions to promote equitable healthcare access and reduce health disparities. I use many search terms to find my articles to stay specific to my issue. Some of these terms I used were listed here, such as health literacy, social determinants of health, health disparities, socioeconomic status, health equity, patient education, access to health care, and so on and so forth, as you can see on this slide. Different inclusion and exclusion criteria that helped narrow down my search were including peer-reviewed articles, excluding non-peer-reviewed sources. They would need to be written within the last 5 years, that it be written in the English language, including examining health outcomes related to health literacy, excluding studies focusing on populations that were not at risk of health literacy issues, such as like the highly educated or affluent groups. Another inclusion would be including interventions aimed at improving health literacy. I had many articles, but these are, this is the first of 3 that I'm sharing with you. This one is titled, Does Health Literacy Mediate the Relationship Between Socioeconomic Status and Health-Related Outcomes in the Belgian Adult Population? This study examined the role of health literacy in mediating the relationship between socioeconomic status and health outcomes. It found that individuals with lower socioeconomic status, indicated by factors like education, income, and tend to engage in unhealthy behaviors, experience poorer health, require more medication, and utilize preventative care less frequently. This study revealed that health literacy partially mediates these effects, accounting for about 2.1 to 16% of overall relationship. These findings suggested that enhancing health literacy among low socioeconomic groups could help reduce health disparities. However, further research is necessary to fully understand the mediation effect. The second article is Social Determinants, Health Literacy, Intersections and Controversy. This study examined the connection between low health literacy and health disparities, especially in marginalized groups. It stressed the need for better measurement tools for health literacy and socioeconomic status to ensure fairness. Key findings showed that low health literacy contributed to health disparities and that current measures may be biased. This study advocated for improved communication from healthcare providers to better support patients and emphasize involving minority researchers to reduce bias. Ultimately, it called for new measurement methods and a focus on enhancing healthcare communication and increasing funding for health literacy interventions in these vulnerable communities. My third article that I'm sharing is titled Understanding and Responding to Health Literacy as a Social Determinant of Health. This study addressed health literacy challenges by advocating for targeted interventions for high-risk groups and empowering individuals to manage their health. It introduced proportionate universalism, ensuring that health literacy initiatives are clear and accessible to everyone. Improving communication through training healthcare workers and enhancing digital health outreach is essential. Additionally, individuals need skills to find and use reliable health information in online resources. The study emphasizes the importance of tailored support for groups most affected by the problem of low health literacy. Some talking points that I wanted to touch on was the population affected, which is lower income communities, particularly racial and ethnic minorities. They often struggle with health literacy. Nearly 36% of adults in these groups face challenges navigating the healthcare system due to poverty and limited education, making it harder for them to manage their health effectively. Current management and deficiencies is another point I'd like to speak on. While there are programs aimed at improving health literacy, many fail to reach those who need them the most. Existing initiatives often don't consider the specific needs of marginalized communities, leading to a lack of engagement and support. Additionally, many resources are not available in accessible formats, reducing their impact overall. Necessity of change is my next talking point. Improving health literacy is essential for closing health outcome gaps. Researchers show that higher health literacy leads to better management of chronic diseases and reduces overall healthcare costs. By addressing health literacy, we can tackle the root causes of health disparities and promote healthier communities. Just like Gandhi said, you must be the change you wish to see in the world. Moving forward to future management and policy recommendation, we need to develop health literacy programs that involve the community input and focus on their tailored support. Incorporating health literacy training into healthcare education will help providers communicate more effectively with their patients. We should also prioritize digital literacy, ensuring community members can confidently access online health resources, especially as telehealth becomes more common. My recommendation to address the limited health literacy in lower income communities is I recommend implementing comprehensive, culturally sensitive, community-focused programs that leverage digital platforms and involve diverse researchers, as these initiatives can reduce health disparities, improve health outcomes, and lead to cost savings by better managing chronic conditions. This is my reference slide. This is the end of my presentation. Thank you for your time and attention.